Hello everyone, we are students of Ashok Ramani Institute of Pharmaceutical Sciences and Research Savvy. Today we conduct seminar on over-counter sale. This seminar presented by Siddhi Munde, Sneha Varan, Vishwajit Patak, Omkar Natulkar, Anuja Sangpar, guided by Mr. A.N. Dhage. Over-the-counter sale. Introduction and definition. OTC drugs are medicines sold directly to consumer without a prescription from a doctor. They are also known as non-prescription drugs. OTC drugs are usually regulated by their active pharmaceutical ingredient, not by the final product. They are normally have ingredients that are safe and effective when used without physician care. The Indian context. First, Indian OTC drugs are not yet legally defined by the government. Second, it is assumed that any drug that does not fall into. Second, it is assumed that any drug that does not fall into a prescription category considered an OTC drug. Third, this lack of legal definition had led to this 28 crore market segment being effectively unregulated. Reason for the hug OTC market. People often purchase drugs from pharmacies without prescription. Several reasons. Prior experience. Due to prior exposure to symptoms, people feel they can purchase drugs they used before. They rely on the experiences of close relatives for similar condition. Perception and convenience. They take their present condition very lightly. They are busy and find little time to visit a doctor. Cost and time. Many patients think purchasing OTC drug saves doctors fees and time. The rise of self-medication. The rise of self-medication. Self-medication is growing daily. People often self-diagnose and treat themselves based on knowledge gathered from the internet and other sources. The popularity of OTC drug combined with advertisement on TV and other media lead to self-medication and large sale value. Common condition treat with OTC drug: headache, migraine and fever, upper respiratory tract infection, cough, cold and flu, stomach pain, heartburn and acid reflux, muscle and joint pain, arthritis, allergic and asthma, small injuries, wounds and burns, athletes, food, cons and acne. Advantage of OTC drug: ensure direct rapid access to effective drug, easy and wide availability of drug, decreased use of common healthcare system, example hospital resources, allow the individual to be in charge of their own health. Patients seek drug in the early stage of disease, which can be responsible behavior. Disadvantage and risk of OTC drug: incorrect self-diagnosis, which can make OTC drug useless, increased risk of drug-drug interaction, increased risk of adverse event when the drug is not used upper, potential for misuse and abuse, daily diagnosis of the correct disease which can lead to incorrect. The pharmacist role in OTC sale. OTC drug sale are the pharmacist role in OTC sale. OTC drug sale are a concern from all healthcare professionals, especially pharmacists. The pharmacist's first concern is the patient safety as people purchase drug themselves. People purchase drug from themselves and their dependents. The pharmacist's first concern is the patient's safety as people purchase drug for themselves and their dependents. Pharmacist must ensure there is a proper understandable label on the OTC drug container. They must provide the required advice and instruction. If necessary, the pharmacist should guide the patient to a physician without dispensing the OTC drug. Pharmacist counseling care responsibility: listen to the patient carefully, question the patient thoroughly, interpret their question correctly, clear their doubts politely. Rational use of OTC drug. The patient must be informed the pharmacist about other drugs they are already talking to avoid interaction. If a patient cannot remember, a general instruction is to give a gap of an hour. If a patient cannot remember, a general instruction is to give a gap of an hour between drug. Prevent overdose. Overdose is a possible as some ingredient, example paracetamol, antihistamine, may be present is a more than OTC drug. Healthcare professional may instruct the patient to stop all other healthcare professional may instruct the patient to stop all other drugs with taking the new one. Patient must be informed of the OTC drugs dose, contraindication, duration and side effect.
Encourage patients to purchase both prescription and OTC drugs from the same pharmacy. All drugs must be stored properly and kept out of reach of children.
Moving drug from prescription to OTC. Long time use. The drug has been used for a long time, example 5 years or more. High volume use. The drug is popular, has high acceptance and is sold in high volume. Manufacturer request. If a popular drug is no longer prescribed by doctor, manufacturer may apply for it to become an OTC drug to prevent stopping its manufacture. Thank you.